What do you see as the industry's response to quarantine taking a larger role in what they do?
Well, that's very true in the situation that we're in now with COVID. Quarantine has taken a much larger role and giving guidance to the cruise ship industry. And VSP has sort of taken of course, the ships have not been sailing, so they haven't been doing the inspections, the routine public health inspections. But I think the industry, as it always does, is able to uh, sort of adapt to whatever's going on. And they've certainly been very adaptive to what's going on with the quarantine requirements now. And I just was on I just did a little bit of work on one of the cruise ships, and they're following the guidance of quarantine and of the Centers for Disease Control and doing the best that they can given the information that they have.
Okay. I guess it's kind of a toolkit conversation here, but so there are different tools that the industry, that ships can use in response to outbreaks. You developed a very interesting one for global public health services in the contagion circle. Can you explain a little bit more about that to us?
Sure. Well, actually, we were thinking about the basics of public health and the spread of disease and of contagious diseases. And in my early academic history and everything, we talked about the chain of infection. And of course, that chain starts with a host, and then through various methods, it's spread to other other people, and it could be through animals, it could be through objects that are touched, it could be through aerosol, and just a variety of mechanisms. But we were really, at the time, we were thinking about norovirus, and of course, norovirus is also a virus. And although it affects different part of the body, and it enters through the you have to swallow it, so it enters in through the intestinal system, uh, and COVID, of course, is inhaled or goes through the respiratory system. There's still a lot of similarities, and so the model that we sort of created was really for norovirus, but also is effective and works for COVID. And when it comes to a cruise ship, you have to think of well, first of all, norovirus and most viruses end up being person-to-person spread. A lot of the bacterial diseases are spread by what we call point source, or maybe water or food or recreational water. And some can be spread by person to person, but with viruses, it seems the majority are spread through person-to-person contact. So when you look at that on a cruise ship, you just have a whole number of sources and of connections. So it becomes more of a circle than with a lot of or a group of circles all connected than it does the typical chain that we talk about. And for instance, you might have passengers that are on board, and then you could have passengers that are joining the ship. All these are potential sources of contamination. You have crew members that are already on board, crew members that are joining the ship, and this happens on almost every new cruise. And then you have the ports of call that the ship goes to, and there you have passengers possibly interacting with passengers from other ships. You have passengers that they're interacting with people that are vendors on shore. They may be riding in the same buses or transportation vehicles. Again, they're interacting with a variety of people on shore, including passengers from other ships.